Morning, all. Hope everybody's having a good Wednesday. If you're looking out the window or haven't been out yet, you'll be a little bit ticked off that you put away your snow brush for your car because you might have to wipe it off if you're going out this morning. But my assessment is probably a little later in the day, it'll all be gone anyway. The nice thing was, I didn't see anything on the roads. So that was kind of refreshing, particularly because I know I don't have to go home and shovel my driveway at the end of the day. So that's always a really good sign. But anyway, welcome this morning. We're going to talk a little bit about rapid screening in the workplace and how important it is. And I'll give you a little demonstration on how it works. I know some of you are probably doing it in the workplace, which is really fantastic because I think it's really important. Just to give you maybe some statistics to begin with, what the federal government, Health Canada, actually tells me is that about a third of all cases or individuals, rather, about a third of individuals will not show any symptoms if they get COVID-19. Not even runny nose or sore throat or absolutely anything, which really speaks to the, I don't want to say that the virus knows what it's doing, but it certainly seems like it knows what it's doing because it is actually saying to itself, well, let's not show symptoms in everybody because then we reveal ourselves. Let's hide in some people and not give them any symptoms. And then that'll be a great way for us to be able to infect as many people as we possibly can. And that's really the sneakiness. And maybe I think from my perspective, maybe the danger of this virus. And quite frankly, I think why scientists and public health officials around the world are very concerned about this because they have really, it's difficult for them to predict what's going to happen next when in fact you've got a virus that can hide in someone unbeknownst to them or anyone around them and then cause some pretty significant issues, especially in the workplace. So, the reality of it is the workplace is a breeding ground for spread. It's all of the data comes in and basically says that the reason why the numbers go up is because people in the workforce or workplace are congregating in certain areas, and this is no fault of themselves. If you don't have any symptoms, but you have COVID, and you don't know you have COVID, it's not really your fault that it's being spread. It's your, trying to do maybe the right things, but it's certainly doing its job. So a third of individuals will get COVID and will not show any symptoms. And here is the big startling number, is that 55% of all confirmed or diagnosed cases have come from an asymptomatic carrier. So 55%, over half of all confirmed and diagnosed cases have come from individuals who had COVID and didn't know they had COVID. So, the reality of it is when you sit back and look at the science of that and the realities of that, common sense prevails and says, we maybe need to spend a little extra time trying to identify who the asymptomatic carriers are and isolate them away from individuals, not to penalize them, but let's face it, the objective here is to stop this thing from spreading so that we can all get back to relatively normal lives. So we called on my colleagues in Best Waterloo, who, by the way, we have a breakfast with all of them coming up at the end of May. Don't forget to sign up for that. It'll be a fun breakfast, and we'll talk about some of the initiatives we did and some of the traction we got with the federal, provincial, and local governments throughout the pandemic. But we called on the government to institute a rapid screening or testing program in the workplace last May or April, actually, when the rapid kits started to come out or started to be made available, we said this is really important. We need to identify the asymptomatic so that we can at least do our very best to try and mitigate the spread. Well, we all know the challenge that government has. We've talked about that many, many times, where the government has good intentions, but the execution portion of it is oftentimes dragged down by bureaucracy and paperwork. And I always use the example that the reason why government goes so slow is because the hallways and doorways are all stacked with piles of legislative paper. And it takes them a while to climb over top of it, and they're tripping and falling over it because that's just what government does. It generates a tremendous amount of paperwork and legislative controls and regulatory controls. And, they just sometimes really have a difficult time getting things moving. So finally, around the end of February, I got a phone call from my colleague at Communitech, Ian Klugman, who was appointed back in mid-February, the first part of February, as kind of the czar for rapid screening in Canada by the federal government, and said, Ian, we want you to kind of mobilize and figure out how can we get rapid screens out to people in business and employees so that we know that they're safe. Well, that process started to go. We were negotiating or talking myriad of meetings with federal government officials, assistant deputy ministers in the provincial and federal government. And what was really interesting to hear was the federal government was all gung ho. They had, some crazy number like 47 million of these tests sitting in warehouses all across the country, and said, obviously we need to use them. We've got them sitting in warehouses. Let's get them out. And they were almost, in a panic state to try and get these things mobilized. And of course, Ian Klugman was really doing his job and saying, come on, we got to get these things out. And he did all of the research and data collecting on the effectiveness of them. Well, part of the problem is in Canada, although we have a national healthcare program that is a universal healthcare program, the execution or delivery of healthcare is really the responsibility of the provincial governments. And so you have to work within their regulatory framework as well. Even the federal government has to work within the province's regulatory framework. And I know we're in a pandemic, and what I was saying all the way from the beginning was, who cares about the regulations? Let's just get this thing going. We're in a different time, and we need to make sure that we execute as quickly as we possibly can. But, there were bumps and hurdles. Provinces have really different views on how they screen or the process behind screening, and we just said, well, we got to figure out a way to get everybody on the page, and it was really a hurdle that we almost felt we couldn't overcome. We did make headway in the province of Ontario. The original, and most provinces are like this. In order to do one of these screens, you need to be a health professional. Some provinces actually define a health professional as being a nurse or a doctor to perform the screen or to do the screen on an individual. And we pushed the bar a little bit. We got the province of Ontario to quickly say, we will extend who is a healthcare professional all the way down to massage therapists and, whoever, anybody that kind of works in the healthcare field could actually administer one of these screens. And we still pushed. And then finally they changed the regulations and said, okay, we're going to authorize in the province of Ontario, the only province in Canada, we're going to authorize self-screening. So that means that you can actually do the screen on yourself. And I'm telling you, when you see me do the screen, you will know, you all know that I'm not the sharpest knife in the drawer either. And if I can do it, I can tell you just about anybody can do it. But what they did put in is they put in a caveat to say, well, we need to have an individual who is trained and understands how the screen is supposed to be properly done and can watch the person actually do the screen. So, we kind of conceded, yeah, that would be fine. Because really, quite frankly, after we did it several times, we found that, once you do it once or twice, 3 times maybe, you know exactly what to do, and you can pick it up and you can do it yourself almost in your sleep. So we thought, well, that's fine. Let's at least get the process going. So the federal government was all excited. Ian Klugman came up with a brilliant idea. Let's wrap some buses. Let's put something out on the street so that everybody knows we got rapid screening in the community. Put kind of a spotlight on it. And what we'll do is we'll set up a website so that employees of businesses can go on and register and come down and get a screen at a bus. And we'll move the buses around in the 3 communities in our region. Well, that was on a Friday, and on Saturday morning, I woke up and I thought, who is going to do that? Right away, I thought of my good friend who comes on to just about every single one of these chamber chats, Mike Black from Valet. And I thought, I really can't see Mike getting all excited about his employees going on and scheduling themselves for a screen at a bus that's located on Ainsley Street in Galt, and halfway through the day, they're going to say, oh, Mike, I got to leave for my screen. It's at 2:00. It's 1:30 now. I'll be back by 2:30. Well, in the middle of a shift, that's not going to work probably very effectively. And then to try and schedule them outside of your shift hours might be really complex and difficult to do. So I sent an email to the federal government on that Saturday morning when I kind of came to that conclusion. And I said, look, why don't we have, a 3,000 square foot visitor center that obviously isn't being used because we don't have visitors traveling through the province of Ontario. Why don't we just get a whole bunch of these things and we'll just let the business community know they can come in. We'll do a video right in our facility. They can get trained there so that we know that they know or understand how it's done. And they can just pick up kits, maybe a 2-week supply or something like that, and take them back to their workplace and get people screened. Federal government thought, yeah, that sounds like a really cool idea. Why not? Let's do that. So about 4 days later, I finally got a hold of 3,200 kits, brought them over to the office, got them set up in here. And then we planned for the Tuesday rollout. The buses were going to be launched. The bus program was going to be launched on the Wednesday. And so we thought, well, we didn't want to get kind of lost in this real colorful, bubbly bus program that's, the media are going to be probably all over. We want to get the message out to businesses specifically. So we thought we would do our launch for the direct to business screening program on the Tuesday before the launch of the bus program. Well, staff put all of the wheels into motion. We got a hold of all of the media that we needed to have. We had CTV down here. Ian McLean, who Greater KW Chamber of Commerce is partnering with us on this program. He came down to our facility and he and I actually did a screen live on Facebook, Facebook Live, as well as CTV was filming and doing all kinds of interviews. We had lots of media around, lots of attention. Well, what we did not know is at the very moment that we were actually doing that, individuals who were setting up the program for the pilot program for the region of Waterloo were on the phone with the Provincial Ministry of Health. And the Provincial Ministry of Health said, no, we can't do this. We haven't got all the T's crossed. We haven't got all the I's dotted. The mounds of legislative framework around this haven't been printed out yet. So we have to wait until all that happens before we can actually kickstart this. And of course, this individual who's on the phone with the Ministry of Health also had their device beside them and saw Ian McLean and I on Facebook Live telling businesses they can come into the Cambridge Chamber of Commerce on Wednesday morning and pick up their kits. And he looked down at that and then said to the individual in the Ministry of Health, it's too late. The program's already started, and businesses will be self-screening probably by tomorrow afternoon. So sometimes, not often, but sometimes working with government, maybe you have to take a chance, roll the dice, and say we need to ask for forgiveness rather than permission. Well, we certainly did not know what the uptake would be on this. We thought that people would be interested in doing this. Why not? Everybody's kind of concerned and interested about keeping their workplace safe. But the next morning we opened our portal. Monday morning we opened the portal at 9 a.m. and said you can go on and you can book your picking up of your screening kits for your workplace. And as I said, we had 3,200 screening kits here in the office. And by 10:30 in the morning, all 3,200 were spoken for. And of course, then the sweats start and the panic starts because orders are coming in like crazy. I immediately phoned Ian Klugman up at Communitech, and he said, "Oh, gee, we have probably 17,000 kits in our tannery building." And I said, "Great, I'll take them." So Thursday morning, I drove up first thing in the morning, and I loaded his 17,000. Now he has none. And the bus launch was supposed to happen the next day, but I took all 17,000 because we needed them. And, things just simply progressed from that point where we now have, about 60,000 kits out in the community, testing employees in about, I think, a little over 800 businesses. We now have orders. We're up to very close to 1,000 businesses will be in the region of Waterloo will be using this to screen their employees twice a week. And that's kind of where our recommendation is from Health Canada is screen your employees twice a week, and you'll hopefully catch some of those asymptomatic carriers. But since that point, it's been a very exciting journey. As the media got a hold of it, and provincial and national media got a hold of it, we start getting phone calls from chambers of commerce in Saskatchewan and in Alberta and Manitoba and British Columbia, all interested in doing this thing all over Ontario. And we, we had just started. So, we didn't have all of the dynamics in place of how this was going to work because it was all a speculative optimism that we had for it. So we started to work on a manual and a handbook, a playbook, basically, for the Canadian Chamber of Commerce and the Ontario Chamber of Commerce, because we knew right away, as soon as we saw the uptake. Right now, I've got about 100,000 kits sitting in my front lobby for pickup, and probably most of them are spoken for at this point. Maybe not quite most of them, but half of them for sure are spoken for at this point. We're getting order now once a week, comes in every Tuesday morning, 50,000 kits. We'll probably be upping that every week by 5 to 10,000 kits coming in. There is virtually an unlimited supply of these. The federal government has said we have 47 million. Go ahead and hand them out, and if we need more, we'll get more. There's not a scarcity of these kits. They're plentiful, and they can be gotten very, very quickly. So we started working on the handbook and the playbook. The Canadian Chamber, Perrin Beatty, he and I were on conversations over a weekend, and he said, we need to mobilize this across the country. And I said, well, you got a little bit of work to do because most of the provinces don't have a regulatory framework that'll allow for individuals to self-screen. And if you don't have self-screening, you're not going to get a company, a small business, to hire a nurse or a doctor to come in and screen their employees. So you need to get those regulatory items dealt with across the country. And right now and we're like 2 weeks into this. We turned in our playbook. We finalized our playbook for how to set one of these up last weekend. I was on a call yesterday with about 30 or so Ontario Chambers of Commerce who are in hot zones. The provincial government's really interested in getting these out into the hot zones because they're the problem area, especially in workplaces. I'm going on a call later this morning with manufacturers from across the province of Ontario to talk to them about how important this is and why they should be doing it. Larger companies, if you got 500 employees or more, you can actually we can arrange to have direct shipments right to the workplace. So you don't even have to come in here to pick them up. That would be pretty onerous for us, but you can actually get them shipped directly to the workplace. And so there's about 1,100 companies in the province of Ontario right now that get direct shipments from the province for these screening kits and do screening. You can't make it mandatory. So if those of you who are thinking of getting into it, you can't tell your employees that they must. But really what ends up happening is most employees see other employees doing and feeling good about getting a negative result. And they all want that same good feeling and comfortable feeling. So it doesn't take long before all employees say, yeah, I think I'm going to screen as well. So it's been, pretty remarkable from our perspective that a little program that started here with a little idea on a Saturday morning of saying we can probably get this out to many, many businesses that is now probably by the end of the month will be in just about every community from coast to coast to coast. And businesses will have the ability to go to their local chamber of commerce and pick up a 2-week supply of screening kits and make sure their workplace is safe. I'm going to talk about the efficacy a little bit of these screens. A lot of people wondered, they heard because if you Google it or you go online, there is probably 100 times more false information than there is positive or correct information online. It's just the nature of the beast. Everybody thinks, oh, there's something in the swab, and they're it's all fake, and there's nothing accurate about it. The actual science says that if you actually do have COVID-19, that these are so close to 100% accurate. It's almost they don't even say that it's 99.2 or 98.6% accurate. They just say they're 100% accurate if you've got COVID-19. They are pretty measurably 100% accurate. If you don't have COVID-19, they are still 90% accurate that they're not going to show positive. There is a small risk where you could have a false positive. And then you talk about the negative side of it. So here is where really some of the concern or some of the problem could come in, and what I'm going to talk to you about when I do my screen. If an individual shows signs or symptoms of COVID-19, and it could be any one of the myriad of problems that you are associated symptoms, you should not be using a product like this to screen them to see if they're actually sick so that they can come into work. And the reason is it's probably going to be fairly accurate. Even if you tested someone that had symptoms, you can probably more reasonably than not rely on the outcome of it. The problem is there's always that element of chance you could get a false negative, and a false negative is worse than a false positive. And I'll tell you why, because you could screen someone who comes in and says, yeah, I've got a little bit of a sore throat and I got a runny nose, and I did feel kind of, yucky last night, but I feel pretty good this morning. And they actually have COVID-19 and it comes up as a negative result. And then you let them in the workplace. And then all of a sudden you have COVID-19 running rampant through your workplace. You cannot take that chance. So if anyone in the workplace does have symptoms, they shouldn't be allowed in the workplace, and they should be sent immediately to public health for a PCR test. Even PCR tests have false negatives and false positives, but certainly they're far more reliable because they are a diagnostic test, and they send them to a laboratory, and there's a lot more precision into the actual identification. So we're telling people, because I got all kinds of emails in the very beginning, people saying, well, Greg, if should I only be testing people that have symptoms? I said, no, you should never be testing people that have symptoms. Anybody that has symptoms, you should be directing them immediately back home and to get on the phone and to book an appointment within 24 hours with public health to have a PCR test, and to not let them back in until they get a negative result from a PCR test of public health. That's just absolutely the smart thing to do and the essential thing to do. So let's have a look at this test and see how it works. And you get a box of test kits. There's 25 in the box. The box cannot be separated. And the reason is there's a buffering agent that's got to go into every single one. And there's only one bottle of buffering agent. So it's a very tiny bottle, but the reality is you don't use very much of it. So if you have a company of 20 employees, we give you a 2-week supply. That's 80 kits. But because we can't break up the boxes, we actually give you 100 kits to take back to the workplace, so that you don't break up the boxes. So you end up having plenty of them there, for sure. The first thing you do is you have to, especially if you're doing a larger number of employees at a time, you're going to have to get some stickers to be able to label the vial. I'll show you how to label the test pad itself, but you get this plastic vial, and this is literally plastic. So I'm going to show you right there. You can squeeze it right in half, and it's really important that you're able to do that. It's very, light plastic. It's got a cap on the bottom, and that will come into play very important after we do this. So that's where you're going to drop out the solution. The first thing you do is you take your buffering agent, and there's a little line, and I don't know whether you can see, if I can put it close enough there, you can see a little plastic line right at the very bottom of it. The buffering agent has to be right at that line. So you try, and it only takes about 6 or 7 drops. You get it right to the line, and you're now ready to swab. So you give you can preload these. A lot of people will preload these. Actually, I've had some companies who have made up a tray because they have maybe more than 9 employees. So they made up a little tray so that they've got, or pull this box. You get one of these boxes in every single kit. You can pull out 2 or 3 of the boxes, and you've got them all set up. An individual employee, if you're doing a lot of them, will put their name on this. They could even write it on with a magic marker on the side of it, their employee number or their name. And then you give them their swab, and they open up their swab, and they take this out. Now, I know it looks really, really long and scary, but the fact of the matter is you don't have to put nearly that much up into your schnoz. It's pretty non-invasive process. It's 2 centimeters has to go in, so about 1 inch, but it's got to stay in each nostril and you got to kind of swirl it around in the nostril. It's got to stay in there for about 5 seconds. So it's pretty easy process. Like I've done it a number of times, as you can probably imagine, to show people. I actually do the test video as well. Keep it in for 5 seconds into each nostril and spin it around 4 or 5 times while it's in there. Do the other nostril as well. And this is what your employee will do for themselves. So literally a monkey could do this if they've been shown a couple of times. So no problem for an individual. It doesn't have to be a healthcare worker at all. You then take the swab and the employee will put it in the vial. And then at that point, if you do have a number of employees and they've got their name on the vial, they can leave it in there, and then the supervisor, the individual doing the screening, can finish the process. what you do is you take it and you spin it then 4 or 5 times in the buffering agent. And the recommendation is that you kind of bend it a little bit and press the swab up against the side of the vial so that you can squeeze out any particles out of the swab. And then what they recommend that you do is you pick it up about halfway through and you squeeze the tube. So you kind of squeeze the swab end to squeeze anything out of it you can. And then what you will see is about partway up, about halfway up the swab, the plastic swab, there's a little break point there. And literally you take that break point right near the top of the vial and you just snap it off and let the swab then fall down into the vial and leave it in the vial. And then you put your lid on and now it's ready for the process of actual screening. You will, your employee will be given this screening pad. It's a little plastic cartridge basically, and I'll show you there. You can see the long wide part is where the result will come out, and the little round part is where you actually put the buffering agent in. They can take, what we usually recommend is you have a little Sharpie and you take and put your name on the back like so. And then it's all ready. So Greg's is all ready to be tested and wait for the results. You take your vial out with the agent in once it's been, the swab is put in, and you put 5 drops. And I don't know whether you can see this very well or not, but I'll try and maybe hold it up a little. So you want to put 5 drops right in that little round part. And that's it. You just sit back and wait for about 15 or 20 minutes, and it'll let you know whether you're safe to enter the workplace or go back to your station or do whatever. There are some, oddly enough, the province of Ontario looks at some of this material as being hazardous waste. Obviously, the wrappers, like the paper stuff that everything comes in, that's just general waste that can go in. But the vial itself, and it's not that the buffering agent's toxic or anything like that. It's just that this is deemed to be hazardous waste, as is the test pad itself. You can kind of see here on the test pad now. You can see that the red ink is going across the test pad. And what it will do is it will settle in to the line of whether you're negative or whether you're positive. And I'll show you that once it comes up here. Hopefully I'm not going to show you a positive result, but I'll show you whatever the result happens to be. So what we're recommending and a lot of small businesses don't have the ability to dispose of this. We're working with the Cambridge Memorial Hospital. And so what we're saying is, once you keep the vial and the screening pads separated from the other waste in a little bag. And, once you get the bag gets full and you're coming into our office to pick up your refills for the next batch, you're welcome to bring them in. We have a large bin here that we're doing some collection, and we're going to work with the hospital to be able to dispose of this. We have no idea why the province of Ontario deems that to be hazardous waste, because I'll tell you why. If this is hazardous waste, then so is a tissue that you blow your nose with, because in essence, it's exactly the same. So if you have COVID-19, you blow your nose, you've just created hazardous waste, but we don't know that. So you just throw it in the garbage. So, we're working with the provincial government to maybe say, is this really hazardous waste, or can this just be, because believe me, we've been working on this for 2 weeks trying to figure out how we're going to get rid of this stuff because there's almost no ability to be able to deal with this type of hazardous waste except for a hospital. They're the ones that have kind of the corner on dealing with this. So it's extremely difficult to figure out some of this stuff. So we've just said, bring it us. We will figure this out and we will take care of it. I'm going to answer some questions now that, well, you're seeing how the kits can work, and how you can get them is pretty easy. You go to chambercheck.ca and you can order your kits. Melissa put that in. And I don't see any others. Anybody got any other questions? You can just unmute yourself and ask me a question while we're waiting for this test to complete. These are kind of fun, I actually had, yeah, go ahead, Steve.
Hi, is this available to individuals as well, or is it just to companies?
Just to companies at this point. However, individuals can, if you see the bus, or you can, I think you can go on to Stay Safe, a Stay Safe workplace with Communitech. I believe they have a schedule of where the buses are, and you can actually pull up to a bus and you can go in as an individual and get screened there.
One other question, Greg. We have 3 to 4 people normally at our office. Is there a minimum number of people for companies?
Nope.
No?
For your business.
Okay, so we can order it for our office then?
Yeah, you can order for your office. And so when we talk about can you make it mandatory for people to be screened, in your situation, Steve, there's a really good example where, there is the ability, and in some cases, your folks are working maybe not full-time in the office. They're working some remote, and they're going into the office occasionally. What you can say to an employee, and if you have that type of situation, is no problem. But if you're going to come into the office, you have to screen. So if you don't come into the office, you can choose not to screen. That's fine. But you can put that provision in, because you're not taking them away from the work. You're saying you just got to work at home if you're not willing to screen to come into the workplace. So in circumstances like that, you can put that provision and say, no, sorry, if you want to come into the office to work, you're going to have to screen. If you don't want to screen, then you're going to have to work from home and figure it out that way. So you can do that if you want. But it becomes difficult. Like, Mike Black, like I referred to, how's he gonna, he can't do that. So sometimes, and I'll maybe have Mike, after I show you the result, I'll maybe have Mike talk about it and how his employees feel about screening. But let me tell you one quick story. Had an individual come in who I hadn't seen for a while, and actually I thought he was maybe ailing a little bit, because he didn't look all that good, at least from what I remembered seeing him about probably a year ago last February. And I asked him, I said, are you feeling okay? And he said, oh yeah, I'm feeling fine. I'm great. I said, oh gee, the gray hair really popped in the last year. And he said, Greg, I'll tell you why the gray hair has popped in. He said, for the last 13 months, I get up in the morning and I put my feet on the ground. And he said, the very first thing that comes into my mind is whether or not one of my employees is going to show up to work with COVID-19 and spread it around my workplace and shut me down. And he said, I worry about it all day that I'm there. I'm continually asking people how they're feeling. He said, it bothers me the whole time that I'm awake. I have difficulty getting to sleep at night because I'm worried about what effect this is going to have on my business, even being an essential operation, but very concerned as to what it could possibly do. And for himself, he's, my vintage, so certainly didn't want to get COVID-19 himself. But he says, this is going to be a game changer for me. This is going to actually give me the ability to manage my business through this, because now I can have a better awareness of what's happening in the workplace from perspective of COVID-19. Even if I find some cases, I'll know how to readily deal with them and to protect the workplace as a whole. So he said, maybe my hair will stop falling out now that it's all gray, and I'll be able to retain it at least, because it's been really difficult from a an administrative perspective to get up every single morning and worry about what your workplace is. And then one last story that I'll tell you is an individual came in and got their kits, took them back to their workplace. They have half their employees coming in, every other day, something like that, trying to stagger, keep, the close contacts down a little bit. And he just reported to me last Friday that they did their first screening as a group. There was 5 people in their office. He did their first screening, and he said, they were 5 for 5 negative, which he was very delighted to see. But he said, you know what? He said, I think this is as much of keeping the workplace safe. This is a mental health tool as well, because he said his employees were so jubilant afterwards and felt so good about going home to their family, knowing that they were safe, that they weren't bringing anything back home to their family, and that they were going to be coming back into work on Monday morning, knowing they were going to screen when they came back into work. And that they're going to be able to not only keep their workplace safe, but keep themselves and their families safe. And they just, really appreciated the fact that their employer went out and made this tool available to them. So here we go, the big reveal. There's what negative result looks like. You see one line. Can you see that okay? You can just nod your heads if you can see that okay. No, you can't? A little closer? A little closer. That is a negative result. The red line under the C means it's clear or negative. If there was a red line under the C and under the T, that would mean it is a positive result. And if there was a red line only under the T, it would be an inconclusive result, meaning there is the potential that you could have COVID. There wasn't enough protein elements from the virus that it could positively identify it as being a positive. So if you get an inconclusive as well as a positive result, you should be, in fact, we say you must remove the person from the workplace and send them for a PCR test. It just, you don't really want to take that chance. It just doesn't make sense to take that chance. So every morning when you're checking them, you want to get this result. That's the one you want to look for. And that's a negative result for COVID-19. And what this does is it looks for the protein part of the virus. And in fact, the benefits of an antigen test like this is that there is times when you won't be showing symptoms. You could be pre-symptomatic, and the antigen test will pick up the virus because it's picking up the protein element that's there that really gives the virus the ability to be able to get into your system and make its way into the organs that it wants to affect. So it is a really good test. It's a really it makes you feel a lot better when it's done. And I can tell you, it's not that I've done it so many times that it doesn't seem to bother me anymore. It really is not a bother at all. Mike, what has your feeling been with respects to doing it?
It's been quite positive, Greg. First, I want to just commend you and your staff for following through on this. I can't help but think if our governments had seen the benefit of something like this a year ago, we might not be in so many lockdowns and businesses closed. There was a little apprehensive from some of the employees in the beginning. We have to obviously get their written consent. So I did a nice letter up explaining, what we were doing and how the test worked. And at the end of the day, all we wanted to do was protect them and their family members and fellow employees. What really shocked me is some of our employees are under the age of 18, and we had to get their parents to consent. And some of the parents refused to give consent, which just shocked me. I have no idea why you would not want your son or daughter to come home from work knowing that they're not bringing anything into the household. So from a business owner, that just kind of threw me for a bit of a loop. But it is what it is, and we'll have to deal with it.
Mhm.
But I just think it's a great tool. It's another tool in our belt to make sure that we're operating as safe and efficient as we can.
Yeah.
And I want to thank you for
It gives
doing
you a good feeling. Like you would know, everybody, like I can tell you the very first time that I did, I was a little bit worried, like I thought, geez, what if this thing comes out positive? Like, what am I going to do? I don't want to go for one of those if I don't have to. But you know what? After I did it, yes, it was negative and I felt really, really good about that. But I thought, you know what? Even if it had to come out positive, I'm not only doing myself probably a favor, but I'm doing my family and my fellow employees that I'm working with a favor as well. So, it is almost difficult to understand why people wouldn't want to do it, to make sure that those around them are safe and even themselves. It's interesting.
Just
Steve.
can I ask a question?
Sure.
Mike, are you doing them so twice a week? You're doing them? Are you doing them Mondays and Fridays, or what schedule do you use?
Yeah, because we don't always have all our employees in every day, we start Monday off, and then as they come in through the week for their first shift, they're required to do it. Yes.
So first shift and last shift.
Right.
Is there anybody else on that's doing them? That has picked up their kits, and anybody else on that is saying, I'm going to start doing them?
Greg, I can see though there's almost a feeling of a little bit of a black market happening. I'm getting requests from people that know me that now we're doing this. Can you get me a test? Can you get me a test? It's interesting.
Yeah. And we try and keep away from me. We don't want them on the black market. That's for sure. I don't think the federal guy, and I have actually had conversations last week about the federal government. I said, here's what we got to think of. So let's say Mike Black, one of his employees, he has a positive. Wouldn't it be good if Mike could preload, 4 vials and give them 4 kits to take home and say, look, you're positive. You need to arrange a PCR test within 24 hours, but I'm going to give you 3 more or 4 more kits for the rest of your family members so that you can screen them as well, or get them screened and make sure that they're not positive, or if they are, then you can arrange for everybody to go in for a PCR test and make sure that we keep our families safe as well. Because it stands to reason if you got 3 or 4 in your household and you screen positive, there's probably a better than average chance that somebody else in your household could potentially have it at the same time. So, how do we? If the objective is to identify the asymptomatics and get them out of the workplace and get them isolated so that they can get over it and get it out of their system, then we need to be looking at a program like that. So hopefully that will happen, Mike, where individuals that come to you and say, hey, so-and-so, I was at your shop or whatever, or I need to get a test. We can, have some rationale around how we can make that decision and better judge it, because these actually should be in every single household.
We've actually had requests for that, Gray, especially if they have school children and someone in the school is tested positive.
Yep.
We've had employees come to us say, hey, can you preload me some of these? I just want to make sure my other kids and everybody's okay in the house.
Well, we're hoping to have an answer to that very, very shortly and try and help out, because there's a parallel program as well that the federal government's trying to work on, and I can't figure out why they hadn't launched this, but they're trying to work with pharmacies as well and get them in pharmacies so that citizens can just go in and order a couple of kits, get a couple of kits or preloaded kits, and take them home and do their families. So hopefully. I just say to them, you can over-regulate this to death, but you're not going to achieve the goal that you want. And the goal that you want is to find the asymptomatic carriers. You don't need to worry about finding the person that's sick. The person that's actually sick is going to go in for a PCR test and you're going to find them. it's the ones that aren't sick that we need to find. And that's the only way we're going to beat this, and pound it down so that we can have a more normal summer. Bill, you had a question.
Yeah, I was just Bill Creighton from Chicopee. I just wanted to say thanks. I'm picking up our first set today, and the staff is really feeling good about it. Right now we're down to our in between season staff, so we've only got 13 people on site who will be taking it, and that's great. A couple months ago we could have had over 600, right? But this is awesome, Greg. Thanks for doing this. The staff is feeling really good about it, so we're excited.
That's awesome. It really is. It like, you would not believe how much better people feel mentally after doing it. It really is it's a great program for that. But in the end, we hear from senior medical officials in the province are saying, workplaces are the problem. And it's, what's interesting is, I think the number one was manufacturing and industrial work settings is number one. Number two were food, and that could be food processing plants as well, but restaurants and that kind of thing, dining. So, there is evidence that employees in restaurants were catching it from customers were catching it from employees, and it was going through those channels. So, their community transmission is second to all of that. So if we've got to have workplaces open, which I think all of us on here think we need to have for the sake of our economy, then we need every single tool, as Mike said, to be able to keep our businesses open. And we've done nothing different. We had a lockdown a year ago. We had another lockdown just after Christmas. And every time we opened up and came out of that lockdown, we did nothing different. Still wear masks, still wash your hands, still stay physically distant. So, they have absolutely proved, the government has proved that the definition of insanity is doing the same thing over and over again and expecting a different result. We did the same thing over and over again, and we did not get a different result. We got exactly the same result. So we're recommending that. We're also right now, probably for a while, we'll be also giving with our kits, Eclipse Automation manufactures this level 3 medical grade ASTM mask, and it is an incredible medical grade mask. The difference between this and a cloth mask is about 100 times better. This is way easier to breathe through. It's like breathing through 2 pieces of tissue. But the efficiency rating on this is like something like 90 or 93%. The efficiency rating on your three layer cloth mask is 38%. So wearing this mask is way better and easier. You can breathe better through it. It's just a better choice. Eclipse Automation donated 1.5 million masks to the business community in the region of Waterloo. As long as the 1.1 million lasts, we'll be giving them out with every order of kits, trying to get them into the workplace so that workplaces are wearing a good medical grade mask as well. If you've been following the international news, the Quebec government just 2 weeks ago made medical grade ASTM level 3 masks mandatory in the workplace. You have to wear that in the workplace. And so go online and look at the difference in cases between Ontario and Quebec, because we were almost like per capita, we were almost matched with them perfectly. And they're miles ahead of us now. They're down around, 1,200-1,300 a day, while we're up, to 4,000 a day. And it's some of the measures that you have to change. You have to change them. You can't do the same thing and expect a different result until we get more vaccinations out. And as we all know, that's been a little bit slower than we all would have liked. So do rapid screening in your workplace. Wear an ASTM medical grade mask. And yes, Mike.
Craig, just one question. Has there been any conversation or talk about the contract tracing. Just to take this one step further, you know, if you do have an employee in your workplace, you're using the kit, they test positive. Now the concern is, who were they around?
Yeah.
Who did they come in contact with? Has there been any discussion about cheap, you know, electronic devices or tracking? I watched the 60 Minutes a couple months ago, and the Ford Motor Company in Michigan had given all their employees these watches, type of a wristband type thing. And if anybody tests positive, they would know who and when they came in contact with and how many feet they were within to really narrow down, you know, who should be concerned.
Mhm.
Has there been any discussion around that?
Lots of discussion on that, and the government's really trying to figure out how to do that. You know, all you need to do is look at Taiwan, and Taiwan did that right out of the gate, right? They came medical grade masks. They did rapid testing right out of the gate. They made masks mandatory. In fact, they made not medical grade, just medical grade. They went to N95 masks mandatory in all public settings. And then probably the one thing, Mike, that they did better than any other country in the world, because they're the best, their results are the best in COVID, is they did contact tracing right out of the gate. So they narrowed people down right away who was potentially contracted it through a community transmission. They isolated them, and they did testing on them to make sure. And Taiwan has 28 million people, give or take. We have about 37 million people, something like that. So, you know, pretty close to the same size. The difference is Taiwan is a very small country, and they practically live on top of one another there. They had 955 cases and 7 deaths since the beginning of COVID. So it's absolutely, you don't even need to do the science behind it. It's absolutely clear evidence. What they did coming into the pandemic was exactly what everyone should do. They were, and oddly enough, Taiwan was one of the worst countries in the SARS. So when SARS was there, they had a terrible time with SARS, but they actually learned some lessons. And this time around, they implemented what they had learned from SARS. And what do they end up? The having the best results of any country in the world. Yeah, Steve.
Greg, there was a question from Don Zuber that
Yep.
I think maybe most people would want to get some clarification on. It's about the company's responsibility for reporting positive results.
Well, we're actually doing that right now, Don. We're talking with the federal government. You see, here's where the problem is. The person, according to the provincial law, the person administering the swab is responsible to report all positive cases to public health. But in the province of Ontario, you're allowed to self-administer the swab. So the responsible person is the person that's administering the swab. We need to say to them, you got to leave the workplace, and you can't come back to work until you have a negative result from a public health authority. And that's all we can do. So we were talking about it yesterday. Public health really, because we don't collect, when you report to us, we do not ask for the name of the individual. We ask for the name of the company. We ask for the contact person that we would connect with if there was a problem. And then the number of positives, number of negatives, and number of inconclusives, and the number of screens that you did. So the total number of screens, and then the number of those that were positive, negative, or inconclusive. And that's the only information we get. And we move that off to to Health Canada, so that Health Canada can do the statistical analysis. How effective are the kits being in the workplace? Are we identifying, the right numbers? Is it working the way it should be working? It's more for statistical gathering than it is anything else. And the onus is on the administrator. So if we had to have a health expert do it, it would be the health expert's responsibility to actually report all positive cases to public health. Because we can self-administer, It's up to the individual that actually does the tests themselves. Brian, good question. What if someone accidentally pushes the swab too far up into their nostril and hurts themselves? I'm not sure that it would, but it probably could. Maybe measure down 2 centimeters or an inch on the swab and tell them to hold it right there and just stick that much up in their nose. But I think it'd probably be pretty hard to. I get some people when they're doing it, I watch them and they seem to be bending it back and wanting to go back. You don't go back into the nose. It's an upper nasal swab, so it's just inside your nose like an inch. Any other questions? Well, it's been great. Go to chambercheck.ca and you can order your kits there. There's also lots of resources. Again, you'll be getting, as long as they last, Eclipse masks along with your kits when you order them. They're free. They cost you nothing except time to come in and pick them up. So with that, folks, have a great day. Get your kits and test your people. Thanks very much. Thanks, Mike.